All right, welcome back. How I survived brain surgery. Quick little recap. March of 2023, I was diagnosed with a brain tumor from my gynecologist. April of 23, I met with the endocrinologist at Johns Hopkins, decided to go the surgery route. Now we're at August of 23. I meet with the neurosurgeon to discuss my case specifically. Now for this visit, it was a virtual visit. He looked at my MRI. We talked about the surgery in detail. We talked about complications, risks, and what the recovery was going to look like. And at that point, I had already done a lot of research. So some of the things he was telling me, I had already learned. Some things were pretty new. But essentially for this surgery, they go in, they utilize both nostrils, but they have one dominant side. And they go all the way up your nasal cavity. When they get to the end of it, they hit the base of your skull and they drill through that bone. So if this is like the base of your skull, if this is a side view, they drill through this. There's an air pocket on the other side, and then there's another bone. So now we're here. They drill through this bone, and this is where your pituitary gland pretty much sits. So they'll get the tumor, and in my case, they took out a third of my gland, and then they pull it down the nasal cavity, and then they patch you up. So I'll go into a little more detail about the surgery itself when I get to that part of the story, because we're still a little bit early on. But, so we're talking about that. Now, when he was talking about the risks of surgery, it's kind of a multi-layered thing. So first, it's the risks of any surgery that you have, and that's, anesthesia, how your body's gonna respond to it like that. Then he talks about the risks of brain surgery, which is like now level 2. And then it's the risks of your surgery itself, because everyone's brain surgery or brain situation is different. Now, for mine, and this is going to be like a little bit of an anatomy lesson, because I thought I knew anatomy going into this, and boy, was I wrong. I didn't know a goddamn thing. Now, your pituitary gland, again, is kind of between your eyes, and if it sits right here, your carotid arteries come up on either side of it. Did anybody else think your carotid arteries stop in your neck? Or is it just me? You see movies where they're like, oh, check the carotid, and somebody, checks their heart rate right here, and they're like, oh, I don't feel a heartbeat. So that's what I thought, it just stopped there. I had no idea that these arteries go into the brain, but they go in and basically are the main blood supply to the brain. So that's why if somebody gets cut in their neck, they will bleed out very quickly. Now, for my case, my tumor was like, if this is my right carotid, this is my right, I guess it's your left, but if this is my right carotid artery, my tumor was right here. There was like a sliver of daylight in between it. And that sliver of daylight was my hope, basically. Because if a tumor fuses to an artery, it makes surgery that much more difficult, complicated, or it can make it impossible in some cases. Again, I'm not a doctor, but some of these things I know. So I was very grateful that my tumor had not yet fused to my artery. But he did tell me, for my case, also let me backtrack. When they do this surgery, if they can, they try to kind of move, I don't know what the technical term is, but they try to move your carotid artery over a little bit to make a little more space in there for them to operate. But in my case, I have a bone fragment that formed when my skull was forming as a baby that sits right behind my carotid artery, making it impossible for them to move the artery over a little bit to make more space. And the bone fragment doesn't bother me. I wouldn't have known about it, unless they did these really detailed MRIs and CT scans to see it. But apparently some very small percentage of the population has this bone fragment. And I just happened to have it and had a brain tumor at the same time. So when it rains, it pours. But he said because they couldn't move it over, it was gonna be a little bit tighter. The space they were operating, it was gonna be a little bit tighter. And he said the major risk that he was concerned about was if for whatever reason they were to nick my carotid artery in any way, there would be a 50% chance that I would not come out of the OR, and I would essentially bleed out on the table. When he said that, that was one of the few moments that I really started to rethink, do I want to do this? Should I just get on the medication? Should I just see what happens? Should I, risk those potential side effects? And it weighed on me for a while. It definitely did. But ultimately, as you see from the title, I decided to go through with it. So, after he talked about all of these things, he asked me if I had any questions. Of course, I had a bunch of questions written down, went through all of those. And at the end of it, he said, is this still something that you want to pursue? I said, yes. He said, okay, the next step is we're going to get you with our ENT, which is the ear, nose, and throat doctor, or the technical name for it is the otolaryngologist. But he said I'd have to get with the ENT to do a nasal exam, because before surgery, they have to essentially evaluate the structural integrity of your nose to make sure that your nose can survive brain surgery, and to see if they're going to have to do anything else in that whole process. So I said, okay, and that was my next step, going to see the ENT. We're going to stop there, tune back in for the next part.